Hello, everyone. So maybe you finally brought it up. You tell your doctor, it burns, it's dry down there, sex hurts, and now you're wondering what can actually help. So if you've been feeling dismissed or overwhelmed, this episode breaks it all down clearly, simply, and without shame. I'm Dr. Lola Ashaye. I'm a board-certified family and lifestyle medicine physician and owner of InTouch Primary Care in Sugar Land. And you listen to Connecting the Dots with Dr. Ashaye. If you or your loved ones are in Texas and you've been putting off healthcare due to frustrations or you're just seeking a more personal approach to your health, I invite you to check us out. We're dedicated to high quality healthcare that is accessible and stress-free. So in this episode, we're going to be talking about real treatment options for vaginal and bladder changes caused by hormonal shifts, whether it's from menopause or birth control or medications or something else. And I'm going to walk you through 5 steps that could make you feel better, and we're going to explore them in plain non-medical language, okay? So number 1, pay attention to your symptoms. And I've talked about this in the previous 2 episodes. Very important, helps us come to a treatment decision quicker. So is it dryness, irritation? Is it frequent urinary tract infections? Is it pain with sex? These are not things you have to just live with. So pay attention to them, journal, keep track of them so that we can get to an answer quicker. Next step, typically in my practice, I do a vaginal and pelvic exam, and this helps us rule in or out causes. It can show whether your tissues are healthy or whether or not you have other conditions that can cause irritation of the tissues. It can show areas that are inflamed that you may not even be aware of, but during the exam, during palpation, we can identify those areas, and it helps us guide treatment. Step 3, talk about what matters to you. So sometimes people have a whole lot of symptoms, but you want to think about what symptom is really bothering me the most, because a lot of times we need to address symptoms in a stepwise fashion. You can't just start everything all at once because then you don't know what is working, what's really helping, and all of that. So think about what bothers you the most, write it down. Think about what you want. Do you want something low maintenance? Do you want something that do you not mind using something daily, or do you want something that is, once every 3 months? And then think about, are you concerned about using hormones? Do you need more information about that? And of course, you want to think about your budget as well. So the good news is there are options for all of this, and we're going to go over them. So that's step 4. So step 4, what are the best treatments for vaginal dryness and bladder leaks during perimenopause and menopause? So I'm going to make this easy to understand. This is just a snapshot, and it tells us what's available to help with vaginal dryness, bladder leaks, discomfort during this time period, and other time periods where hormonal shifts occur. So number 1, estradiol cream, also known as estrase. And this is a medication that is applied by like a cream in the vaginal area. It's one of the cheapest option. It is a bioidentical FDA approved option, and it's used nightly for 2 weeks and then twice a week after that, 2 to 3 times a week after that. The second option is something called Premarin, which some people have heard of if they've been around long enough, and it comes in the cream form, and it's also used vaginally. The difference, it's not bioidentical, it's a synthetic hormone, and basically it can be more expensive than the one I just mentioned, the estradiol cream, but you use it pretty much similarly, where for 2 weeks, and then after that you do every 2 to 3 weeks, 2 to 3 times a week after that. You can also use, as a third option, vaginal inserts. So inserts usually are tablets, and they can be inserted with applicator or without, and they're different ones. And they're used again nightly for 2 weeks, and then twice or 2 to 3 times a week after that. So for inserts, it can be helpful for people that maybe have irritation from the cream, And so that can be an option. So that's option number 3. Option number 4 is a vaginal ring called S-string, which you place in the vagina every 3 months. It slowly releases estrogen, and this S-string specifically is for people that have vaginal symptoms. So there is another one I'll talk about in a minute that can be used for both vaginal and systemic symptoms, but S-string specifically is for vaginal symptoms. So now for this one, it is more expensive than the cream and the other options I mentioned. And so you would have to see what is covered by your insurance, or see if you can get some pharmacy. There's some coupons that you may be eligible for. The 5th option is one called FemRing, also a ring like S-string, but now this one has higher doses of hormones, and so it provides both local and systemic estrogen, which can be really helpful for people that also have menopause symptoms. And I talked a lot about menopause last month. You can go back and look at all our episodes about perimenopause and menopause and go from there. The next one I want to highlight is one that is not an estrogen option. It's non-estrogen. It's called Intrarosa. It's a DHEA insert. And again, this one is inserted every night. So it's nightly. It's an insert that can be, that does not contain estrogen. It contains DHEA and palm oil, and it can be very lubricating for people that have symptoms of vaginal and bladder symptoms that we've talked about, and is just as effective as vaginal estrogen. Then there's a tablet, Aspina, which is a daily tablet. It's not estrogen either, but it does help the vaginal tissue. You will have to weigh the risk benefits with your doctor, depending on what other risk factors you have, because now you're taking a pill that is metabolized systemically, and so that's something that you would need to discuss with your doctor. And the last option I wanted to mention is vaginal estriol, which is a compounded cream or insert, and it's actually pretty good for tissue healing. Unfortunately, it's not available in the US under FDA approved. It's not FDA approved in the US, and so the only way to get it is through compounding pharmacy. But so as a result, it's not going to be covered by insurance. So those are 8 options that you have for treatment of vaginal and bladder symptoms caused by hormonal shifts. We talked about the estradiol cream, the Premarin cream, estradiol vaginal inserts, S-string, which is a vaginal ring, just local estrogen, FemRing, which is a systemic and vaginal, a systemic and local option, gives you systemic and local estrogen, Intrarosa, which is non-estrogen DHA insert, Aspina, which is a pill, also not estrogen. It's a serum that helps vaginal tissue, and vaginal estriol, which is compounded, that can be helpful, especially for people that have irritation from the creams caused by from the preservatives used for estradiol and Premarin and other creams. So you don't need to start everything. We're just looking for what works for you, right? What fits your comfort level, your lifestyle. And it's good to know that there are many options, so that if one doesn't work, or that you have something else you can try. And remember, at the end of the day, this is something that a lot of people end up having to use long term. So it might take time to find a good option, but once you found one and it works well, it's awesome. So the last step is follow up with your doctor. They can help you recheck symptoms. They can help you talk about side effects. Remember, it takes time. Sometimes it takes 3 to 6 months to feel better. Hang in there, because when you find the right regimen, it makes all the difference. So remember, it's possible to feel like yourself again. Feel like without shame, without guessing, without suffering in silence. Now you're empowered with information. And again, if you're in Texas and you need help with some of the symptoms, reach out to us at InTouch Primary Care. Go to our website, call the number listed on the screen, and we'll love to help you find the best treatment option for you. And in the next episode, I'm going to be talking about safety. I'm going to talk about libido, non-hormonal options you can also look at. And we're going to talk about like lubricants, moisturizers, simple lifestyle changes as well. And remember to subscribe and share this video with someone who may really benefit from this. I hope that helps.